And we're live. Hey, welcome everyone to tonight's masterclass. I'm Dr. Burt, and I'm really excited to have everyone here. First of all, just thanks for joining and spending the next 20 minutes with me. I know it will be worth it because you're all going to learn some new concepts that will hopefully be life-changing for you. Now, if you're here tonight, you're probably suffering from chronic pain. And whether that be pain in the head and neck, such as migraine headaches, jaw pain, nerve pain into the face, or whether that be kind of spinal pain, neck pain, back pain, or nerve pain shooting into the arms or legs, regardless of where your pain is, if you have it and it's not going away, then you're in the right place. Now, if you're like most people, you probably tried a lot of things out there and nothing has really worked. And I know what you all want because I've worked with many people who all tell me the same thing. You want a natural, long-term solution. And so that is what this class is all about. And that's what we're going to be talking about, right? Tonight, I'm going to show you an entirely new approach that you've probably never heard of before. And more specifically, I'm going to show you one, the root cause of the pain, and two, solutions to correct the chronic pain. All, of course, natural without drug, surgery, or other invasive procedures, because we're not about that. But yeah, let's go ahead and get started. I'm going to share my screen here, dive into the class. To view, here we go. Awesome. Okay. So what I'm going to do is walk through this step by step, really explaining the cascade of how things happen with most people that have chronic pain. And we'll start with the root cause of the problem. And this root cause that I will talk about is also the most overlooked root cause. And so that's what we're going to get into, the most overlooked cause that really hardly any doctor knows to look for. And fortunately, that's where I'm going to specialize and why my patients get such good results. And I'm sure if you hadn't seen, you can see from the pictures, but it is the head and neck injury. That's going to be the most overlooked root cause of the chronic pain. And I always say it's always caused with some sort of head and neck injury. And these injuries, they can be traced all the way back to birth, just the neck being twisted out of the birth canal. Could be the tumble down the stairs, falling off a bike, or the most commonly with the car crashes. And I know those are very, very pressing, and it's just so incredible to see the damage that can be caused with whiplash, concussions, sports injuries. I mean, you name it, those are obviously more of the macro traumas when it comes to that. But really, pretty much anything that's going to jolt the head and neck that can cause this. So now, I would say this, how many people out there and how many doctors out there would you say, gee, Mary, you remember that day you fell off your bike or when you got that concussion playing soccer? No, they don't say that and they don't ask you that. They'll say, Mary, you're getting older. That's what's causing it. Or Mary, it's just in your head. Your diet's not right. You're not exercising enough. You're not taking the pills that I'm prescribing you and all this other stuff, right? Blame. But what I'm here to tell you is that there's a very good chance that your chronic pain is related to a neglected head and neck injury. And so let me show you how this works. This is a complete overview, and I'm going to break down each and every one of these steps, and I promise to keep it simple and easy to understand. So when you injure the head and neck, this is going to do a couple things immediately, and all you can see this animation here, but it's going to tear loose and stretch these ligaments that basically hold your head in alignment over your neck, or your skull in alignment with your first neck bone, which is the atlas right there at the top surrounding the brainstem. And so that's really all it is. Again, simple animation here. The atlas is the top bone in the neck, and so it's going to be shifting out of its normal position, and that's what is going to cause the neck to angle underneath it. And overall, you see this concept we call of an upper cervical misalignment. Now, when this happens, the muscles in your upper neck that are attached to your neck bones are going to stretch. Now, I'm here to tell you that these 4 pairs of muscles are the most sensitive muscles in your entire body. Now, how do we know that? Because of muscle spindle density. Every single muscle in your body has a certain number of muscle spindle fibers or sensors that will detect the change in muscle length. And so all that means is that if these muscles right here are stretched quickly, it will send a signal to the brain telling it that there's an emergency, right? Sound the alarm. And when this happens, the upper neck muscles are going to stretch. And these ones being the most sensitive here, you can see obliquus capitis inferior. That is the most sensitive muscle in your entire body because it has 242 muscle spindles per gram of tissue. And the second one, obliquus capitis superior, at 190. And then third and fourth, we've got rectus capitis posterior major and minor with 98 spindles per gram. And just to do a comparison here, the biceps muscle has 97 total muscle spindles. So not per gram, that's total. And as you know, the bicep muscle is going to be a lot larger and it's going to weigh a lot more than all of the upper neck muscles combined. So that just really shows you how sensitive these muscles really are. Now, when these muscles stretch, this will cause a whole host of problems and pain. Could be migraines, headaches, ear pressure, tinnitus, ringing, facial pain, nerve pain, neck and jaw pain. And that's really why people get really good results with treatment, is because of how connected they are with those muscles, with the atlas and just how it's all connected. Now, when these muscles stretch, the cells inside the muscles are going to activate. And these cells are called mechanoreceptors. And all that really means is that these are the cells that tell the brain that there's an emergency. And it's also important to know that 82% of all mechanoreceptors in your body are located in your upper neck muscles. So this emergency is then sent up the spinal cord, and then it goes into the back of the brain called the cerebellum. And the cerebellum is, as you may know, what controls your balance and your posture muscles. Now that signal is going to continue to a more specific part of the brain called the vestibular nucleus, which is going to be right in front of the cerebellum, really responsible for eye movement and just the eye muscles, the hand-eye coordination. A lot of times you see problems here, you're going to see dizziness, vertigo spells, because of this misalignment. It's all connected. Now that the signals reach the vestibular nucleus, it's going to tell the spinal posture muscles on one side of the spine to contract and tighten. And hopefully everyone see this animation here. But that's it right there. This is why people complain that their back is usually tighter on one side more than the other. Quick point on scoliosis here. Now, first, can chiropractic, specifically upper cervical chiropractic, help with scoliosis? Most times, absolutely. But second, there was a study done where researchers, they took several mice and they purposely damaged their vestibular nucleus in the brain. They hooked them up to a machine to monitor their muscle tone. And the researchers, they found that immediately after damaging that vestibular nucleus, that their posture muscles were tighter on one side more than the other. And the most interesting part was at the end of the study, this was several months later, they imaged the mice and they took some x-rays and found that 25% of all the mice developed a significant spinal scoliosis. And get this, on the convex side, right here, that'd be the convex, that's the side that they had the tighter back muscles. And they knew that because of the machine that they had them hooked up to. And so a really interesting perspective on how something at the level of the brain is going to affect the entire spine. All right. Now, once these posture muscles contract unilaterally along the spine, the body will typically compensate by leaning to one side or the other. Now notice you see this green line. The green line is at the center of her feet, goes all the way up. Now, normally, the line will pass through her nose if she's balanced. As you can see, it's way off center. She's leaning to the left. Now, just imagine how much more low back pressure she has to have here. And the longer that her posture is shifted away from center, the more pressure and compression is going to be placed on those low back spinal discs, or the cushions between the low back bones, low back vertebra. It's just a matter of time before they become less stable, and then they begin to bulge, especially L4, L5, S1, just very vulnerable down there. Now, when these discs are initially injured from the compression, the first thing that the brain will do to heal it is coordinate the delivery of protein, water, red blood cells to the low back. And what do we call this? Inflammation. So now that the back is getting inflamed, which makes it stiffer, it makes it hurt more, makes you want to massage, you stretches, could make you want a cortisone injection, some pills, anti-inflammatories, pretty much anything to try and reduce the inflammation. But I will tell you, if you don't fix what's wrong structurally, then at a certain time, your brain says, okay, this inflammation here, it's just not strong enough, not enough stability. I've got to do something severe here because we are losing the health of the disc. So the last thing the brain will do is purposely coordinate the stealing of calcium from unimportant bones in your body. And that calcium is going to be dragged through the spine and dumped around the injured disc. Now, the goal here is to try and concrete this weak area to try and give it maximum stability. And so after this happens, it's very common to get diagnosed with osteoarthritis or bone spurs at the level of the injured disc, most commonly L4, L5, S1. And all that really happened was that the calcium simply moved from one part of the body to another. One area of less importance to one area of more importance. So if you know someone who thinks that their bone spurs are caused by old age, just know that that's not necessarily true, because remember, the problem isn't that the disc is getting old, but the problem is that the disc has lost its strength and has become weak from all this compression that the spine has taken over the years. And right, it can be all the bending, the sitting, the lifting, all that stuff. Now, one thing that is important to understand, overarching concept here, is that this is an above-down cascade. And that's why we always start with the brain with this, because like concept, right? If you break your neck, does your arms or back work? No. If you break your back, does your neck and arms work? Absolutely. So now that you know what causes the pain, now we got to talk about how to correct the root cause of the pain. And who remembers the root cause? Head neck injury. That's right. Great memory. But that's what's going to be causing that atlas misalignment. And so with that, the first thing that we have to do is see how that atlas vertebra is misaligned. And that's going to bring us to the Atlas X-ray test. And so this test is going to tell us exactly what's going on with your atlas. And this test, it's a series of specific x-rays of the head and neck, which is exactly what you want. And so once we get these x-rays, then I'll be able to zero in on the atlas bone, and I can measure it down to 1/10 of a degree to know exactly how to correct it. And so that's what's most important. And the sad thing is, most doctors, they don't know anything about this test. And even if you do have old neck x-rays before, most doctors, they only take the side view and maybe the view where you're opening your mouth. But really, that's not good enough because you need to see the top-down view to see if there's rotation. And that's the view that we take. I will say this, once we do measure how your atlas is misaligned, then we'll want to gently realign it. And how do we do that? We do that with what's called the NUCCA adjustment, right? The atlas realignment using the NUCCA adjustment. And all this is a specific gentle adjustment that really reduces that atlas and ultimately is going to reduce the stress placed on the brain and the nervous system there. And notice the adjustment's going to occur in the side lying position. Your head's going to be balanced in a very specific position. And then I just use the soft part of my palm to apply gentle pressure right behind the earlobe, which is exactly where that atlas is. Notice there's no twisting, popping, or cracking of the neck. The only thing you'll really feel is the just vibrational pressure for about 30 seconds right on that earlobe. And that's pretty much it. And I will tell you, the proper atlas realignment is going to be the first step to really initiating your brain's natural healing process. And you'll start to see those postural muscles relax along the spine. And that's how we see those discs start to heal, especially if someone's coming in with lower back problems. That's always the main question. You know, how are you going to affect a change up here and see it down throughout the spine? And so that's where, you know, it is based on faith, but I'll tell you, a lot of people really have noticed great results with it. And that's where, if this is something that you are wanting to get scheduled, you know, without a doubt, hey, I want to see what my Atlas X-ray test looks like. You know, that's where we use NUCCA.org, great organization, upper cervical organization, to get this test done. And so you can find a provider near you there. Or if you're local to the Beaverton, Oregon area, you can always schedule on my website, and that's eliteuc.com. And so that's really it. Appreciate your time being here. Of course, if you have any questions, support at eliteuc.com. But yeah, I hope you learned something new and that this information has been to some value of you. And yeah, if you didn't like something, please let me know too, because I'm always here for feedback. So I hope everybody has a great rest of your day. And until the next time, take care.